Okay, so cardiovascular disease. I don't need a show of hands, but I would say everybody in this room knows somebody with cardiovascular disease. Okay, so we're all in agreement. Cardiovascular disease is the #1 cause of death in the world. Okay? And 1/5 of the 20 million people that died in 2024, that's where the data comes from, came from a brand new risk factor. Who wants to try to guess what the risk factor is?
High fructose corn syrup.
Whoa, do that again?
High fructose corn
No, we
syrup.
knew about that one. That's diabetes, but that's good. All right, I won't make you guys guess, even though it's fun to do that. All right, new risk factors. Did those lights just change? Yeah, they're gonna make me do that, guys. Probably in about 2 months, we'll be doing it up there. Because they're all telling me I'm getting too old, I can't remember stuff, and I don't draw well, so I might be getting into that. That all being said, I thought this was very interesting, because a lot of people have been talking about it, and it's been squelched for years. Anybody ever drive up and down the Ohio River Boulevard in 1975? Could you see risk cancers in that region through the roof? Everybody with me? The new risk factors. Pollution in 2 forms: air and noise. Soil. Genetically modified, we'll put organisms. Okay? And we've talked about all this, but what's exciting, JAMA, February of 26, and the Cleveland Clinic, April of 26, is where I got all the data. Okay? And it amazed me. And that's why I wanted to talk about it, so everybody understands, because in medicine, you research. What's the research? I did a research project in 1980 in Texas, and they were looking for the day after abortion pill. And I'm a good old Catholic boy, but I did the study because I had to have that on my resume. And they used sheep. And what they found, this was in 1980, was they could do it. But it wasn't allowed to get into the American populace for use because of regulations. Does everybody follow that? So the regulators are, when I say funded, in my office, I'm independent, so we're allowed to have reps come to the office. So if the reps come to the office and bring food for the girls, who do you think the girls are gonna call? Okay? That's what I mean by funded. And so I've paid attention since '75 of the Ohio River Valley area, because my family were docs in that area. St. John's, that was the first hospital I closed. Suburban General was one of the other hospitals that I closed. All those hospitals went away. But at the time, the disease was being seen. And so we've known for many years, what is that, 50 years plus, that the pollution has consequences. They're finally now looking into it in ways, that's why I cited those 2 articles. Please check them out, because it's starting to move. And what that means is the real data is gonna come out, okay? And we're gonna go through some of this because it does have an impact on heart disease. So if you know anybody or you yourself have heart disease, make sure that they talk to their cardiologist. You know, because I'm of that era where I question all research, because I did it, and I know what that's like. I'll give you a real quick story. Before I started my residency, I worked at Hampton Medical Center, and Tom Starzl came up to take a liver, and he hired me. And one of the first things that happened was baby Tabitha in Tennessee. Dr. Starzl thought the future of healthcare for transplant was to take everything out at one time. We called it an end block dissection. And I was there in Tennessee, and we literally took everything out of the abdomen, kept it alive, and brought it back to present. Well, a guy by the name of Dr. Belzer out of Wisconsin came up with a preservation solution that gave us 12 hours. So you didn't have to do that dissection. So long story short, as soon as we got back, he told me, Coppola, work on a new preservation solution. I went 24 hours. For me, that's great, because I get to write the paper and do all that stuff. Well, long story short, Belzer came into town and everything changed. So I didn't get to write that, but everything worked out. My point to the process is all research, you have to research who's doing it, why, who's funding it. Everybody with me? Cleveland Clinic is reputable. Journal of American Medicine is reputable. And those two, all within the last 6 months, are putting out the data. Okay, so everybody's with me. That's the background I wanted to give you. Now what we want to get into is what is the reason for cardiovascular disease being #1 in the world? 3 S's today. Okay? We should do next time I'll do something like a raffle. 3 S's you gotta know today. And they're the most important S's when it comes to heart disease. And nobody pays attention to it. And when I say nobody, here's the example I'll give you. I speak for the Society of Chaplains. Recently had a meeting, 500 chaplains in the room. How many of those chaplains read their insurance policy for health care word for word? And I'm not even gonna ask you. Does everybody follow me? That's how we get here. The people that make the decisions because we don't even know what's going on. No one reads their health care policy. No one really knows what any of that stuff means. And we're in that process again of doing changes. So what you have to know is these 3 things are the biggest reason that the world is dying of cardiovascular disease. Ready? Medicine comes in 2 flavors. Differential diagnosis, meaning if someone has chest pain, before I could see my attending when I was a resident, I better have 12 reasons why that patient could have been having chest pain. Now, outcome medicine. What does that mean? That means that 92% of chest pain in American males under the age of 50, they say is not cardiovascular disease. But the data will show that up to 20% of them had symptoms that weren't common, and they did have cardiovascular disease. Does everybody follow what I'm laying? I need you to understand this concept. When I trained, it was see one, do one, teach one. My first day of residency, July of many, many years ago, at 2 in the morning, there was a code on a patient that passed away. And as I'm walking out of the room, my senior resident grabs me like this. He goes, put a line in him. I said, he's dead. He said, if you could put a line in a dead man, you could put a line in anybody, anytime. And he taught me a very simple way. Clavicles divided into thirds. Subclavian artery is right underneath the clavicle. You divide it into thirds, bevel of the needle up. At the second, third, needle under the bone, aim for the ear, you'll hit it every time, you can shut your eyes. My sons that are doctors training, well, they're done, but the process, you could not to try putting in a line in an American program without an ultrasound. Does everybody follow me? So if you have minutes, seconds to take care of that patient, what I just told you, I could do it right now with my eyes shut. Any volunteers? Okay, so what you have is changes. Does everybody understand what I'm talking about? Let me give you two more and we'll move on. 1982, Baltimore, Maryland. I was a, what did they call it? An extern, meaning you don't get paid, but you were still doing intern work. So June 29th, I was on call, admitted pneumonia through the emergency room. You go down, see the patient, you see the sputum they're coughing up, you look at their chest x-ray, you write orders, and you go to bed. July the 1st, because we were on every 2 days, July the 1st, I get called to do a gram stain in the emergency room. Anybody know what a gram stain is? That's how you determine if it's gram positive or gram negative bacteria. And it requires dyes. And these are the kind of dyes that they're on your hands, you can't avoid it, and it takes like a week for it to wear off. So when the nurse told me that, I said, I haven't done a gram stain since medical school and I'm not doing one now. Hang up the phone. I get called from the program director. And again, this is 2 in the morning. Coppola, get your bleepity 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 bleep or you're out of the program tomorrow. You know what they did it for? It was all done for LOS. Anybody know what that stands for? Yes, length of stay. 1982. They designed the program we're living under right now. And that is the most important thing is length of stay. Okay? So we call it a huddle. Every morning on the floors when you're rounding, you get together with the nursing staff and you talk about all the patients. Now, they talk about who's getting discharged and what time are they leaving. So everybody understand what I'm telling you? Because you have to understand why this is so important to pay attention to. Because now it's being published at reputable places. We've known for years the environment is a factor. All right, does everybody follow what I'm telling everybody? Because you have to understand as we move. All right, sugar. Everybody in here will tell me that they don't use sugar. Everybody will say that the amount of sugar they use is minuscule. But does everybody understand that every dessert has either natural or unnatural sugar in it? Okay? And there's a lot of things that sugar are in. And if you don't read the label, you don't know. What's the problem with sugar? Inflammation. I should do it on somebody. I don't want to pick on anybody, although you might get picked on before this is over. What you do is you take a chair and you put it against, you put your head down, you pick up the chair. Then you put a teaspoon of sugar in your mouth, you can't do it. Try it. Get a young person, have them stand, if this is the wall, a couple feet back, bend down so their head is touching the wall, and have them lift up a kitchen chair. Stand them up, put a teaspoon of sugar in their mouth, they can't lift it up. You follow me? Women can. Testosterone, estrogen. They're different. Please pay attention to that. The sugar affects women more than it does men. But it's a higher inflammatory process. That's why men can't lift it up. And that's what this is all about, guys. It's inflammation, and we talked about it. But I'm going to walk this all through so you understand exactly how it works, okay? If you're not looking at the amount of sugar in what you're eating, you're not paying attention to one of the biggest risk factors for the disease that kills more people in the world than anywhere. And there's 4 billion of us now. Does everybody understand that? That's important. That's why I put it number 1. Because no one pays, if it's sweet, there's sugar in it, period. Okay? And the artificials are even worse. But that's another lecture coming. I think that's in May. So avoid it at all costs if you possibly can. And if you have to, use the smallest amount possible. I can tell you another story. So my wife goes away now sometimes 2 weeks at a time. So long story short, I like a thing about this big and that big a round of iced tea mix, okay? And I dilute it so it's not bad. And that's one of my, vices that I have to, not have to, but I'll have a glass of that periodically. So I ask her for a new one, and she gets stuff dropped off. Like she calls in and people drop stuff off at the house. It's not like she goes to the store. 4 weeks go by, I didn't get one. So what I did, I took the lemon jar in the refrigerator, squirted some lemon into the water, and then I went into the dining room. I found out I'm not allowed in the dining room, but it was too late. And then I take the sugar bowl that's her great-great-grandmother's china from Sicily. And as I walk in, I trip, and the top falls and breaks, okay? So then I take the sugar, and I put it in, set it down. I still have it. It's funny. She came home a day early on me because she thought it would be great to surprise me for Valentine's Day. The house wasn't ready for her to come home a day early. Before she was coming home, she's saying stuff because she was away for 2 weeks, saying stuff like, "Oh, I can't wait to hear your voice." And as soon as she got home, I got it. "Don't ever talk to me again." So the point that I make with everything, guys, is we're creatures of habit, and we don't pay attention. What I did after reading that article, there's less sugar in the regular sugar than there is in that can, by a lot. And that's what, no one's paying attention to. You guys seen the new commercial on TV? It shows athletes. It's called Factor. It's a dinner that's all prepared, and you just take it and heat it up. Had a patient come in yesterday on 4 high blood pressure medicines. And she tells me, new patient for me, she tells me her diet's wonderful. 300 milligrams of salt is all you need through a day. 300. Guess how much was in the meal, one meal? 1,080. Healthy choice. Sorry guys, this is my bookie. Healthy choice, sounds healthy, 950. What am I setting up? Segue. Any of the beer drinkers out there? There's salt in beer. Why is there salt in beer? So you can keep it on the shelf longer to sell it. Why is fructose corn syrup in beer? Same thing. Okay? Please pay attention. We didn't even talk about the fructose corn syrup. That's at the very end. But when I say sugar, I'm just talking, if you taste it and it's sweet, there's some type of sugar in it. And please pay attention to, it's an inflammatory process that occurs in your body quickly, and that inflammation leads to what we're going to talk about with the heart disease. Everybody with me on that? The salt, please pay attention. And if it says CL, I have people that talk about, is it Mrs. Dash? Is that the one? If you look at the bottle of Mrs. Dash, it has KCl. So it's a salt. But it's not NaCl, so it's not sodium chloride, it happens to be potassium chloride. And that's why it still tastes like salt, but it still will increase your blood pressure, and what would do, it causes inflammation. That's the biggest thing we want to take home today. All right? I'll get into more of the details with that in a minute. This is the big one. That's why I told you my story about residency. 2 ways to learn. Obviously, see one, do one, teach one. But you either had intimidating professors or nice professors. What does that mean? Your responsibility as an intern, you had to call the attending. An intimidating attending, you had every book opened and you're looking at everything as you're talking to him because he's going to ask you questions and bust your chops. A nice one, you just get on the phone and tell him what you just learned to the patient that was in the emergency room. What's the difference? Stress. It's high stress. I coached for 15 years. I never yelled at a player on the field. Now when they got off the field, but on the field, why? Because their parents were there. You follow me? There's many ways to do things. The American medical system today is the largest stress for employees ever. There's not one employee, from the person that mops the floor, to the aide, to the nurse, to the physician, to the extender, that isn't stressed out. I'm not, because I'm independent. I'm not owned. When you're owned, you're told what to do, when to do it, how many minutes you have to do it, and you better have this done or you're out. And then they move you someplace out of here, but still part of their network. Does everybody follow what I'm telling you? Stress is huge as a risk factor. You have to pay attention to it. Okay? Now, what do all these things do? Now we show you the body. You guys didn't know I was an artist, huh? Wait till you see this. He's got a big mouth. That's not bad. Pretty good, huh? All right, this is the esophagus. Esophagus. What's the doctor do when he can't spell? Scribble. Okay, so this is the esophagus, taking the food down, and we'll draw it like this and put an S for the stomach. Okay? So what is behind that? We'll put it here. Heart, aorta. Okay? And what's the responsibility of the heart and the aorta? To pass the blood all through the body. And we want no resistance at all. Of those three things we talked about, what causes the most resistance? We know they start with an S. Instantly, when my wife said, I'm pulling down the driveway, I was like, oh no. You follow me? Woo, instantly. All my blood vessels were like this. You know, the fight and flight, I'm thinking, oh my God, how do I get home? So I called her right back and I said, hey, do me a favor. I have a package down at the post office. She's like, get it yourself. And then I heard the door open, so I had to hang up. But again, instantly, your blood vessels clamp down, preparing for the fight and flight response. Instant, like the second the stress hits. Okay, that's one. What about the stress that never leaves? My mother-in-law lived with us for 11 years. Imagine being home with mother-in-law, wife, and 3 daughters. We'd come back from something and the kitchen talk would be, did you see those earrings? Did you see those shoes? And they're looking at me like, I talked to the person, I don't even know what that kind of earrings or shoes they had on. But the point still comes back to stress immediately reacts in the body, and that immediate reaction is to prepare you for whatever's coming. Once it relaxes, everything is good. But if there's a chronic stress, it's significant, okay? Am I promoting psychology and psychiatry? No, but talk to somebody. And I would recommend not a friend, okay? The only reason I laugh about that is I recently had somebody, they talked to a friend of theirs, and then I guess the friend told a bunch of other people, and she was all upset because she didn't tell the person not to tell anybody, but it ended up being more stress than less stress. But the point still is, guys, The most important thing to recognize is that the body, that's why I drew it like this. We have what's called the vagus nerve, and it controls rest and digest. Okay? And this is sympathetic, this is parasympathetic. This is flight. It's like what happens is you have that reaction, and we all know it because we've all had it. You don't know where it comes from, but it gives you what you need for that moment. You know, when fear hits you for whatever reason, you see better, you run faster, all those different things occur because of the fight and flight response, okay? So again, what I want to make sure everybody understands now is the physiology. The vagus nerve controls everything in the GI tract. The sympathetic nerves are through the body, and they run through the spinal cord. And the reason I'm bringing all that up is that if you have an injury and inflammation occurs in that area, it's stressful on your system. Does everybody understand me? So it's not just the stress that my mother-in-law's home, it's the stress of you bump into something, you gotta pay attention to it. So many times I find people of all ages, teenagers, they'll come into the office, you ask them anything hurts, they say, yeah, my toe hurts me. And you take a look, and it's horrible. There's an infection. They don't even pay attention to it. Stress can happen with any aspect of your body, not just from the neck up. So you have to pay attention. It can happen if you eat hot food and you don't like hot food. Stress. Does everybody follow me? It's important to recognize, guys. All right, now the part that I'd like to make sure everybody recognizes in terms of the vascular system, and I'll give you a statistic. This is global now. 8 billion is the number. Every 40 seconds, someone dies from heart disease in the world. Okay? That's big. And what we said at the beginning of this, 20 million people died in America in 24. 1/5 of them, it came from not the normal risk factors, the new ones we're going to talk about. So everybody with me? What are the risk factors for heart disease? Environmental, they're talking about global warming because of the floods that it causes, because of the forest that we lose, and how that impacts the air that we breathe. The one I didn't know, I scribble when I can't write, that says cloning. I didn't realize that unless you look and see, and if it says GMO, that's genetically modified. If you see GMO on fish, don't eat it. They're clones. They're all genetically modified, and that's how they're reproducing. And we don't know. I can't tell you, don't eat it because it causes X, Y, and Z. What we know it does to the body is it's an inflammatory response because the body's not used to that. Okay, everybody follow me? Pay attention. Please read labels. If we're not reading labels, it's tough. The air and the breathing. The particles that they talk about, say it's particulate matter. It's amazing, guys. The stuff that comes out of the smokestacks, the things that go into our rivers, it's not regulated as it once was. You know, I remember we used to go to Erie for vacation all the time. And all of a sudden we quit going because it was so terrible in terms of littering and everything else. And then I happened to be up there going to college when they, put a whole plan through, spent a whole bunch of money and cleaned it all up. Right now, the air that you breathe in isn't as clean as you may think it is. You're fine here, you're protected inside, There's nothing that's coming over top of you here. There's no factories around, a lot of woods, because the trees take up most everything that's bad for you. So I think you're safe. I don't think you have anything to worry about, but make sure you pass along to read those 2 articles. Tell people about those 2 articles, because it's so important to now at least pay attention to this as a risk factor for cardiovascular disease. Okay, guys, let's go. The main ones, I would think that we can go through pretty quick, but the other ones I want to show you how it works. All right, we'll do the stomach just so we know where it's at, and then we'll put the heart behind it. And we'll show the aorta, we'll show the carotids, we'll show the arms and the legs. And we got to show one of the most important organs in the body. And who pays attention to it? Nobody. Adrenal gland. Who pays attention to it? Nobody. It's called the renin-angiotensin system. And the results with this is increased blood pressure. And we'll go over all this. I'm just drawing it up so everybody sees what's here. What we want to make sure we understand is the kidneys get 1/4, the heart gets 1/4, the GI tract gets 1/4, and the rest of the body splits up 1/4. What is all those fourths? Every time the heart pumps. You with me? Every time the heart pumps, 1/4 of the blood goes to the kidney. How big's your kidney? Size of your fist. How many nephrons are in each kidney? 1 million. I didn't misspeak. So something the size of your fist that has 1 million, what we call them is, they're called organelles and tubular system. The best way I want you to think about it, it's like a strainer. Like whether it's rice, spaghetti, whatever you're straining, colander, I think they call it. So think of the kidney as a colander. 1/4 of every time the heart squeezes, all that blood goes through the kidneys. And what do the kidneys do? Everything. Everything. They control your blood, they control your bone, they control your blood pressure, they control everything. And how do they work? Hormones. What's the gland that takes care of them? Sits right on top of them. It's the adrenal gland. How big is it? Size of your thumbnail. How big is the hypothalamus that it regulates with? Size of your little fingernail. It's called the sella turcica that holds it. If we took our finger and pushed it straight through till your nose stopped you with your thumb, you'd be tickling your sella turcica, which is where the hypothalamus sits. That's the pineal gland that controls it all. They call it the eye of the world. It sees everything. And imagine how small it is. How does it see everything? Blood flow. Is everybody with me? Blood flow. So something that small that regulates every hormone in your body, every function in your body, how your bones turn over, how your blood is made, everything. You don't want to disrupt that flow. Yet, almost every product on the market today affects the kidney, especially high energy drinks, which if you watch the Super Bowl, you saw 30 commercials. Everyone has it, okay? And what's in it? All has to, every time the heart squeezes, so imagine someone drinking one of those, okay? After they drink that, every time there's a squeeze, hundreds of milligrams of caffeine are going through the kidneys. Is that good? No. Sugar, artificial sugar, going through the kidneys. Is that good? Okay, and why is nobody paying attention to it? Because it doesn't hurt. Why doesn't it hurt? Because it sits in your back, the flank. That's where the kidney is. It's not in the abdomen, it's retroperitoneal. It's outside of the peritoneum. Everybody follow me? If you feel it, you have a kidney stone. Trust me. I've had one. If you get back pain, you don't know where it came from, check your urine right away. You know, they have dipsticks in the pharmacy. Just go in and say, I want to have my urine checked, see if there's blood in it. Trust me, there'll be blood in it. Why? We don't drink enough water. But is everybody following me? Because we're going to go through how the environmental things that we inhale or we take in, every time there's a squeeze, the kidney's getting that blood. And that's what seems to be causing the problem we're going to go through. Does everybody follow what I said so far? Good. All right, I'm going to keep this up. We're going to come back to it. Let's do it this way. I have so much paper today, maybe I'll even draw it again. All right, so kidney is on there as one of the organs that can cause trouble. What's the other big one that no one's talking about? And it's causing many, many problems. Okay? Oop, look how fast we're going back. Stomach, heart, liver would be here. So when the food comes out of the stomach, it's called the duodenum. It's a C shape. The pancreas, the liver, all the contents from the stomach all come in here. That's where digestion occurs before we get 100 and some feet of small intestine. Your intestine would go from here to George sitting there. Okay? That's how the body functions. That's how it needs to function. And what happens is, when too much sugar, too much salt, too many environmental particles get into your system, inflammation occurs. What's inflammation? We've all had a cut, right? We've all hit, bump, cut, whatever. Scab forms. We all know what a scab is. What's a scab? Scab is taking all of the body's healing cells and capturing it. So those cells go there, and the next thing you know, you have a scab that forms. And if you don't touch it, which most of us do touch it, but if you don't touch it, one day it falls off while you're sleeping or doing something, and your skin looks perfectly normal again. That's the process of healing. But those inflammatory cells are traveling through the whole body, including a fatty liver that's not as effective as it used to be. What's the age groups I'm seeing it in now? 17 to 25. And what's wrong? It's in everything. Fructose corn syrup. And especially things that children, especially youth at that age, they're doing all these high energy drinks. They're eating cereal. They're drinking sodas. You know, all these things have it in. And so what you have is, imagine the heart's pumping, sending the blood all out. What percent comes to the liver? That's part of the quarter, because it goes into GI and it gets there fast because it comes right off of the aorta. So 1/4 of all the blood now is going into a fat-infested environment. Does everybody follow me? So you have now inflammatory processes going on. You also now have the fat is over the body's outside. It was never over the liver before. Now it's all over the liver. What's it do? It squeezes on the liver. It leads to cirrhosis. It passed up alcohol as the leading cause of cirrhosis in the liver. So everybody follow me. Please pay attention to that. All right, guys, I want to make sure that I get the concept. I saw that fall. Bladder, prostate, ovary, I'm scribbling, uterus, breast. I'm going to draw it like this. Okay, this is a quick drawing. Everybody remember the old tape recorders that you pushed it down and that little white thing touched a piece of tape? That's how RNA turns into DNA. There's different types. And the messenger one is the one that sends the signal, and then it gets duplicated in the ribosomal RNA. Why I'm bringing that up is, it's an intricate process with inflammation, with elevated blood pressure, with the problems that are going on with our glands now, with everything that's changing in terms of what we're eating, what we're drinking, and then some of the things that we're putting in that we don't know the effects of. We're changing the environment of the liver as well. And so what we're ending up with is bladder cancer, prostate cancer, ovarian cancer, uterus cancer, and breast cancer that is off the charts. Like they talk on the radio about how they're improving it, it's true. Chemotherapy, radiations, modifications, and mastectomies, yes, there are many, many treatments for it. Yes, you can cure it. But don't you want to get rid of it? You know, don't we want to find a way that it doesn't occur? If anybody has it in their family, and everybody knows we do, go back generations. A generation back, the people that would be like maybe 110 years old now, they didn't have breast cancer. It wasn't there. The sugar, the salt, and the stress, please pay attention. It's important. All right, so I'm bringing all these things up because we're going to get back to them, and I just want to make sure everybody gets the sense of what we're dealing with. The kidney and the liver are by far very important organs. But with the bladder, female, breast, ovaries, uterus, and male prostate, what's happened is that we've run into a society that drinks everything but water. I can't get men to drink water. I can't. Even the ones that have had prostate problems. And you tell them, look, you won't get up all night if you drink water. So drink 10, 12 glasses of water, stop about your dinner time, whatever that is, 5, 6, or 7, and you might still get up one time at night, but you won't be as bad. And they honestly tell me they can't, and I respect that. But what I'm trying to make sure everybody understands is, think of a glass of water, half empty, and now you put inflammatory cells in there. What portion of that water are the inflammatory cells? Let's say for the heck of it, 10%. Now what if you double the water? It's down to 5%. Does everybody follow the concept? We're 75% water, the brain's 90% water, and all this inflammation, sugar and salt, and stress is flying through your system. Water helps tremendously. And it has an effect on the uterus. It definitely has an effect on the prostate. And there's theories that the inflammatory cells, if you don't increase the water, can have an effect for what? Mutations. What I showed you with the RNA, DNA, we all don't pay attention to it because everything usually works well. But if you would look at the intricacies of how that all works, it's very, very specialized system. And once there's a mutation, that's where we end up. That's where the environment part comes in. Does everybody understand what I'm talking about? So let's show Mr. Sun. They haven't given me yellow markers yet, so I better say sun. Okay, and then we'll put a cloud. And then we'll put a factory. I'll draw the bottom of it. And then we'll show the water and the soil. And probably put waste. What do they call them when they go someplace and dump them? Like all the garbage trucks dump them someplace. Just put it, you guys will know I mean waste. They call it something. Like they claim Long Island was built like that. Like all the waste was put there over many, many, many years, and that's how the island formed. All that being said, this is the environmental part that has come up, and even though we've known for 50 years in this valley what it's caused, they're finally talking about it. So the salt, the sugar, the inflammation and the stress that we've already just talked about, so you understand the impact in the body and how the environment affects it. What we have now is when it rains, okay? When it rains, that rain hits the water, it hits the soil, and it hits the waste. When that occurs, think of ice, steam, and water. At different temperatures, you get ice. Different temperatures, you get water vapor. You know, regular temperature, it rules. All chemicals are like that. So imagine the garbage dump. okay? Sun's out, 80 degrees. And now the water hits it. And if you haven't seen them, guys, they're wide open. Like, the garbage just gets dumped and they pull away. It's not like it's encased in anything or protected in any way. So what happens? When that hot water or hot weather in the waste gets hit by water, there's a definite particulate that moves out. Does everybody understand that concept? And this is, every day it's happening. They haven't changed this. Soil. That was interesting to me. I live on a farm. I grew up on a farm. Soil is very important. And what we used to do is mix different crops at different places and sometimes let an area not even have anything on it, you know, just to get the soil back. And so it's vitally important. And once again, genetically modified soil is amazingly popular. Who's the one on TV that promotes it? She went to jail. Some lady with real good etiquette. It'll hit me. Who? Martha Stewart. What she promotes, do you see that soil she promotes? Yeah. It's all genetically modified. Okay? And once again, you need to know that. And it's on the, it has to be on the label. If you see GMO, stay away from it. Because it's going to cause a reaction in your body. And that reaction that occurs in your body has an effect on the blood flow through the heart, to the kidney, to the liver. Those are the big ones. Everybody with me? All right. Clouds, there's a lot of questions of fuel burning, the planes, all the different things. I don't know that answer. In terms of climate change, same thing, guys. I'm apolitical, I'm independent all the time. And I'm putting it there because you're gonna read it in the article. You know, in the article from Cleveland Clinic and JAMA, they talk about global warming has an effect that leads to flooding, that leads to these forest fires, and has an impact on the environment. Okay, so definitely it's part of it. Why I'm showing it this way is to make sure. Now, what we know from the sun, climate control, the rains, and what I just described here, nothing compared to, let's just say, burning. That'd be the best, because they all burn. All right? No one was able to prove it, is what I understand when I read. But if you were around here in the 70s, you knew what it was like driving down High River Boulevard. And you can see it. You can't deny what you see. My father trained here in Pittsburgh, and he said he was from Mount Pleasant, little farm town, and when he came to Pittsburgh, they used to have to wear like white scrubs, and he would go in white and come home gray from the smog and the pollution in Pittsburgh. Okay? Does everybody follow? This trumps all this. And this, better than it was, there's no doubt, but it still goes on. Okay? All right, so how do we want to tie this all together? Cardiovascular disease. Number one, cause of death. And reputable researchers have shown that 1/5 of that 20 million that died are from, I'm just going to put environmental. Treat. Technology has advanced. Listen to your cardiologist. If you don't have one, make sure that your PCP knows your heart. And that's either through you have a cardiologist and they get information, or chest x-ray to see the size of the heart, and EKG to see what's going on with the heart itself. Things like lipids definitely play a factor. Sugar, that's why we mentioned diabetes, plays a factor. Family history, which kind of ties this all together. I tell the story that if I go see my grandmother, the plate of spaghetti, it was heaping. I couldn't even eat it today. If you didn't eat 2 of those, she gave you castor oil because she thought you were constipated. Okay, that's how we grew up. But again, it worked because everybody was working. I mean, we were burning off more than we were tacking on. As I'm fat again after the wedding. All right? So, paying attention, these are common ones. Alcohol, smoking, and I'm putting energy drinks. Why are they risk factors? Alcohol. What's alcohol that no one pays attention to? Alcohol is sugar. It's what it is. What do we talk about? Causes inflammation. The concept is called holiday heart. If people have a drinking binge and they go in on Monday or Sunday night and they've had a high content of alcohol, it can lead to a heart attack. And it's called holiday heart. But the point of all this is that these are risk factors that we've known forever. And we still end up with, it's number one and growing. Why? All the stuff we talked about, guys. You have to pay attention, read the label. If it says GMO, stay away from it. And again, back to this is, I didn't put the stress on that. Stress relief. What was my stress relief? Mother-in-law goes away for a 2-week vacation. It was awesome, okay? But once again, that was I'm telling you guys, my kids even noticed it. Dad, you don't yell at us as much anymore. It changed because you're always like tense. You don't want to be tense. So what's the relief? Relax. Easier said than done, right? I get the trait from my father. We work too much. My father would come home from work. We ate 6 o'clock every night, and everybody was at the table. 6 o'clock, you had to be there. Back then, or he'd beat you, right? So 6 o'clock, you had your dinner. At 6:30, he'd say to me, "Hey, wake me up in 10 minutes." Like, what the heck is 10 minutes? It's relaxation. It works. Am I telling everybody to take 10-minute naps? Do it. I was just in Italy for my daughter's wedding. Fiestas are awesome, man. Like, could you imagine every afternoon getting to just take a nap? And they live longer. They don't have as much heart disease as we do. But you have to get the relaxation in. That's different for everybody. What do you do to relax? Everybody's different. What is relaxation? Comfort. What is relaxation? Calm. No worries. You want to try to achieve that because it definitely helps and it builds up. If you start doing relaxing things, the next big stressor that hits you isn't going to be as bad. I call it noise, which I didn't get into right with the noise pollution. If you're close to any types of factories where you hear a banging or you hear some kind of noise, you just can't get rid of it. And that noise that's in there clamps everything down. That's the stressor. So make sure you pay attention to that. All right, now, here's the thing that is best. Dark room. It's called guided. I'm scribbling, I don't know how I write down. Imaging. And I wouldn't have believed it if I wouldn't have seen it. Betsy O'Neill, she does what's called integrated medicine. I went to one of her programs, and I was actually in the back, so she told me to do the lights. So she gave the lecture, and then she said, okay, I want everybody to think about something calm while Dr. Coppola turns off the lights. And she gives me one of those. So I hit the lights. 5 minutes, she says nothing. And you're supposed to be thinking of something relaxing. And she's at the mic, and all of a sudden she starts whispering. She goes, now imagine walking on the beach. And she goes through this thing. Take your arms at your side and shake your hands and your arms. And I'm doing it, like I'm following what she's telling me to do. And as she goes through it probably took her, I think she said it was 7 minutes that she spoke. And then she gave everybody 8 minutes to relax. And I'm telling you, I fell asleep because she started yelling, turn the lights on. I literally got that relaxed in that period of time. So it works. She used to always talk about we don't use the power of our brain. So I'm telling you, my father would take 10-minute naps, and I saw it work. 8 minutes, I followed her guiding the imagery, and I fell asleep. There's something called NewCom. I don't know if you guys ever heard of that. They might have apps for it now. But I had a girl I worked with at Suburban. She had one. It looks like an iPhone, and you put these earbuds in, and you put these black things over your eyes. So even if you open your eye, it's dark. It's not music, but the sound is so soothing. It's incredible. So I go in, she has like a little place you come into. It looks like a big overstuffed chair. And you lay back, you put all this on, and she goes, okay, how much time you have? And I said, give me a half hour. I woke up an hour and a half later. I'm telling you guys, I've done it. It is so calming, and it's not music. Like, as soon as it starts, you think it's music. Like, I think it's like an orchestra or something, because there's a sound you hear, but it's not music. And it is so soothing, you cannot imagine. It was invented by dentists to calm their patients down before procedures. Now, all sports teams in America use it. And it's not expensive. New, N-U-Calm, C-A-L-M, NewCalm. All sports teams are using it. I did it. It definitely works. Now, doing this, the cardiologist, it's amazing. Dr. Smith, if you guys go to him and know him, don't tell him you heard it from me. But he fell down the steps yesterday. And so what did I say? I thought you quit drinking. Yeah, but it's funny how I was talking to him about all this stuff, because he has a lot of my patients and he has a big practice. And what we talked about was trying to set up some trials where you get some people to go ahead and do it and see if they have a benefit from it, okay? So what you want to find is a way to calm down and try to do it twice a day. And remember, I fell asleep in 8 minutes. It's not like you have to do each one of these for like an hour. I would say do 10 minutes. 10 minutes of finding a way to calm yourself down. And I think what you'll see is next time a stressor hits you, it won't be as tough on you as you think it may be. Okay, does everybody understand what I went through? All right, now, what'll happen is, just for the cardiovascular part real quick. So you go into the doctor and you tell them you have chest pain, or you're short of breath, or you sit up at night short of breath, you have pain in your jaw, or your shoulder, or you feel your heart racing. Any or all of those will lead to what's called a stress test. If anybody hasn't had one, they're very simple, but if you can't walk 12 minutes, they inject you with medication. So you get a medicated stress test. If any of this comes back questionable, you go to what's called a cardiac cath. Ooh. And what the cardiac cath does is they put it in your arm, and it is a vessel that takes them right to the heart. And when they get to the heart, they can put the catheter into the arteries that sit over the top of the heart. The three main ones are called the LAD, that's the left anterior descending, and the left ventricle is the one that squeezes the blood around, so that's an important one. The right carotid artery, or coronary artery, back of the heart. And then the circumflex goes between in the middle. Those are the three main. So if there's a question, that's how they're gonna handle it when I train. Now what happens, everything is rapid fire. Unfortunately, it may take you a while to get in there. You have nothing to worry about here. Hit your bell, hit the little thing that someone comes and sees you, tell them what you got, and you get taken care of. But pass it along to make sure that if you have symptoms that are different, and we all know it's different. If you're having different symptoms, call the ambulance. Here even, hit the button because they'll call the ambulance to come up. Ambulance people, trust me. I used to ride with them back when I was in medical school. They love to do blood pressures and listen to your heart and check an EKG. I mean it when I tell you that. They say they're not real happy sometimes if all they're getting called for is to pick somebody up because the spouse can't do that. But otherwise, they like coming out to see patients and they like assessing patients. Okay, is everybody with me? Please pay attention. Inflammation is a problem. We're now hearing about the environment and the inflammation that it causes. I didn't even go over vaping. They're tailoring all the vaping to children. Everybody think of aluminum foil. It comes in different strengths. Like you can have aluminum foil that you could put half the turkey on and it'll hold the turkey. And then you can have aluminum foil that you put a piece of hamburger on, it'll break through. Well, they use the cheapest metal for the vape, so those little particles of metal are getting into the lungs and they've already lost children. Okay, is everybody with me? Good, guys. Thanks for listening. Any questions? Good. And I was on time. Remember that, I was on time.